Everyone, thank you for joining us today. My name is Catherine Johnson. I'm the Executive Director of Disability Rights Iowa. It is my sincere pleasure to welcome you to our inaugural event celebrating National Disability Employment Awareness Month. I am about 5'7". I have dark, curly, reddish brown hair. I have a lot of freckles, and today I am wearing, to honor this great event, one of my nicer suits. It's a gray houndstooth suit with a white blouse underneath. The pronouns I use are she, her. Today for this wonderful conversation, we have both American Sign Language interpreter and captioning. If you are not able to see the captioning, you need to turn it on in the lower right-hand side of your screen. There's a button that says captioning. Turn that on, you'll be able to read along with the captioning. I would appreciate it if you would turn your video and your audio off, which I see that most people on our camera have done that today. We are recording this discussion. It will be posted on DRI's website at a later event. And today, if you have a question, please send that into our chat and we'll be monitoring that. If you would rather call our communications coordinator, Caitlin Schultz, you may do that also. Her phone number is 515-452-0757. And we'll do our best to answer all of your questions as we go along. Before we get into our discussion today with our amazing panelists, I want to send out a few thank yous to people on our team whose help made this event possible. So first off, we have a big thank you to Caitlin Schultz, our new communication coordinator. This is one of the very first things she had the pleasure of working on. And so thank you, Caitlin, for all your work in making this happen. Also like to thank Katie Vandervoort, our outreach manager here at DRI. Without her technical assistance and great organizational skills, we would not have been able to manage this event today. I'd also like to thank everyone at DRI. The entire team has been very helpful in putting this event on. Some of us were able to join us today, which is great. I'd also like to thank our board and the PAMI Advisory Council for their support in this event. So as I said, this is our inaugural event today to celebrate National Disability Employment Awareness Month. This month was indicated by Congress about 50 years ago as something that we needed to set time aside as a society to recognize both the contributions that individuals with disabilities made to our workplace, but also to recognize that this is an ongoing need that we systemically as a society are not addressing to the maximum capabilities that we have. There is still underemployment for individuals with disabilities that are interested in working when you compare individuals with disabilities to people in the general population. There's still a very significantly low number of people with disabilities working. This year's celebration is really looking at COVID and the implications of COVID in the workplace and how we work during pandemic. There's been both good and bad things that have occurred during COVID, more bad than good, I would say. But some of the good things that have happened is it has changed the landscape of work. And I think it's changed the opportunities for employees with disabilities to work both in places and times and spaces where work has not been recognized or valued before. And we're going to talk about that today. 31 years ago, Congress did pass the Americans with Disabilities Act. Part of the preamble of the Americans with Disabilities Act was to provide for society the eradication of discrimination based on disability. One of the things that Congress was particularly concerned about is the ability of individuals with disabilities to enter into competitive work and to have full inclusion in work. As I said a few minutes ago, this continues to be something that we as a society have just not really figured out how to do in the way that Congress was intending to do. So we're looking at these issues today, along with COVID, working during COVID, and also the new disability that COVID has created, which is long COVID, and the implications of long COVID on working. So we have three panelists joining us today. I want to take a few minutes and introduce them. I'm going to have each of them do a brief introduction. So first off, we have Sonia Reyes, And Sonia, if you could indicate which of the panelists you are, that would be helpful. She's a multicultural expert, keynote speaker, consultant, advisor, and equity and inclusion professional. Thank you for joining us, Sonia. We have Dr. Hall. Dr. Hall, if you could indicate, thank you. Dr. Hall is the director of the Institute for Health and Disability Policy Studies at the University of Kansas. And then we have Jeannie Tehan. She's the assistant professor of theater at Susquehanna University, I hope I pronounced that correctly, who directs productions, teaches acting, and research science plays. So thank you all for joining us today. This is very exciting to have this great panel for our very first conversation as we celebrate National Disability Employment Awareness Month. DRI will, going forward, always have an event like this during the month of October. So please set your calendars to join us next year also. So I want to turn and have each one of our panelists talk a little bit about their personal bio. So why don't we start with Jeannie?
Sure thing. Well, thank you again so much for having me here today. It's a great honor to be a part of this panel, though I of course wish we didn't need to have this panel. My name is Jeannie Tehan. I'm originally from Nebraska, and I spent many years living in Nebraska. In fall 2019, I moved to Pennsylvania to start as an assistant professor at Susquehanna University. And my hope and expectation was that, I'd get my feet wet that first semester, and then in the spring and the summer, I would have this amazing chance to meet other people and socialize and create a community here, which of course we all know that did not happen for spring 2020, summer 2020. I had COVID in March 2020, basically right around lockdown. At the time, because of the symptoms that I had, I could not get a test. There weren't many tests, if we remember, to go around. So it was a lot of navigating that on my own. I don't have friends and family here other than the friends that I've made in my time here in Pennsylvania. So it was very strange to be kind of navigating a lockdown, this strange pandemic, and also having this new health issue in which there was very little help or guidance given to me. I recovered from the acute illness, which a telemed doctor told me, I think on the second phone call that I waited for several hours, that they thought I had long COVID based on some of the symptoms I was describing. And then for the next several months, I would have a series of issues, including costochondritis, I was told, because of all the chest pain that I had. I had issues with breathing. I continued having issues with my heart rate, which became the predominant major concern issue through the summer and into the fall of 2020. And I had other issues as well: strange pains, strange sensations, inability to regulate my temperature, inability for other sort of bodily functions to be functioning normal. And I was often the first person in front of doctors here that was describing long COVID. I thankfully found some organizations online that were giving me guidance and help, but it still was a lot of navigating this on my own. And then also at the same time, still being new at this career, a non-tenured faculty member, still having all these expectations of here we are trying to teach under these new circumstances, and what is this going to be like? So again, thank you for having me here. I'm looking forward to learning a lot myself. Thanks.
Thank you, Jeannie. Let's go to Sonia next, please.
Good morning, everyone. My name is Sonia Reyes. I'm originally from El Salvador. I came to the US when I was 16, and I arrived in California, and then I moved to Iowa in 97. So I've been here since. And I had COVID last year in July. I started to feel weird, but I had my two college-age children were at home, so I was more worried about taking care of them than my own symptoms, and until I fainted in the shower and ended up going to the ER. They did a COVID test, and then they sent me home. The next day, coming out of the shower, I fainted again, and my daughter found me in my bedroom. And so I by then I could not get up without fainting. So we ended up calling an ambulance, and they took me to the ER. Where I got admitted, and I had 4 COVID tests done while I was in the hospital with pneumonia, with a fever 105 to 106 that won't come down for days. and all of the COVID tests results kept coming back negative, which was very frustrating for the medical providers, because then that meant that they had to run other tests to see if it was something else they could rule out. So I know my heart, my liver, everything is working because they checked it all last year. But finally, they called an infectious disease doctor who ran other tests. And then finally one came back positive. So they stopped with all of the other testing. And I was there for a week straight, and then off and on a month after that. And I live in Des Moines, and yeah, and I still have symptoms or the post-COVID issues. It's great to be here.
Thank you, Sonia. Thank you for joining us. And then we'll finish the introductions with Jean.
Hey everyone, I'm a white female with light brown hair wearing glasses and a multicolored sweater. My pronouns are she and her. As Catherine said, I work at the University of Kansas. I'm interested in health and employment policy for people with disabilities. I'm passionate about giving a voice to people with disabilities in my research, and currently conduct the National Survey on Health and Disability through a project. So we have the opportunity to hear about the healthcare experiences of people with disabilities across the country. I have not had long COVID, but I do identify as a person with a disability.
Thank you, Jean. Thank you for joining us. And so I want to turn and talk about working during the pandemic during the last year and a half. And I will never forget my boss coming into my office on March 13th of 2020 saying, well, why don't you gather your belongings? We're all going to be working from home for a while. I had in my head, oh, a couple of weeks, right? So I gathered only kind of the bare essentials, went home, got myself comfortable in my sectional, and proceeded to start working. The first day I returned to actually working in the office is in my new job as executive director of DRI. That was June 15th. So I'm assuming everyone here has had kind of a similar work experience, right? Of being told you're radically changing when and how you're working, which has lots of implications in terms of work-life quality, right? But also implications for accessibility that a lot of people were really ill-prepared to address. So I just kind of want to have each of you talk a little bit from your personal perspective of how has it been for you working over the last year and a half or so. And let's start with Sonia. We'll start with you this time, please.
Yeah, just like you, I thought I was going to be working from home for a week at the most. And I always said I could never work from home because I'm not disciplined enough to get up early and be at home. But I ended up loving it. When I was at home, both, like I said, both of my college-age children, I came home. So the three of us were working, studying from home in a two-bedroom apartment. So it was very challenging to be able to, one, have self-care time and just to be able to function as we were normally functioning. But I ended up loving working from home. We came back to my full-time job in August, 100% here. And since that happened, it seems like my health just took a turn for the worse. When I was at home, I wasn't going anywhere, so I felt better. But now that I'm back at work, not so much.
Thank you, Sonia. Jeannie, let's turn to you next.
Yeah, so being a college professor, teaching that last spring of 2020 was, sort of just making do, since so many students didn't have their textbooks or plays or things for, I was supposed to, because I teach theater, I was supposed to direct a production that just got canceled in entirety because there just was no way to salvage that. It was sort of just making do that first semester. And then over the summer, the school that I teach at, Susquehanna, offered training to teach things online and hybrid and make all these accommodations, which of course was just also extra work and extra time. And here I was navigating hospital visits and cardiology appointments and also trying to train to prepare myself for the fall. I was able to take the option to teach remotely entirely in the fall, which I'm very grateful for. I think it helped a lot with aspects of my recovery. but I was teaching classes like acting and directing again a production on Zoom entirely, which was a whole new thing for us theater people who like everything to be in person and like the immediacy of an audience and the actors on stage. Instead, we're doing everything on Zoom. So it was, challenging both in terms of navigating this with my health and my own well-being, while being grateful I was having this accommodation met, and also those struggling with students who didn't quite understand why some of their classes were in person and this class, which feels like it should be in person, is on Zoom, and having to be really honest with students about why I needed that accommodation for this past fall. In the spring, it was hybrid, so some classes were Zoom and some classes were in person. And then this fall is everything back in person. And like Sonia says, I have definitely felt the change of everything being back full time and 100% energy on my health and my well-being a little bit more this fall than I anticipated.
Thank you, Jeannie. And Jean, anything you'd like to add about your experience over the last year and a half?
I would just say that I've only been into my office twice in the last 18 months. I've worked from home all the other days. The biggest challenge for me is just that work-life balance, because you're always at work if you're working from home. So you have to learn to take care of yourself.
Thank you. And I would say for me, I was fortunate in that I had the ability to work fully remotely during the pandemic. I would say interviewing for a new position and moving during a pandemic, the whole interesting experience. And then starting a brand new job where I felt, at least personally, the need to come into the office and stop working remotely. So that has been a very interesting transition that really did take a toll on both my physical and mental health. Just you get used to, at least I did anyway, working alone, right? And that isolation, which also brings depression coupled with that. But I had forgotten the energy that it takes to actually get somewhere at a certain time to work, and the energy that it takes to interact with people instead of boxes on a screen, right? So energy, both good and bad. You get a lot of energy, at least I do, from interacting in person with people. I had really missed that during the pandemic, but I did find it to be very taxing, to kind of readjust to that. And that's taken for me a few months to kind of get back into the flow of not reacting every time I would come across someone and actually talk to them in person. I started off that conversation by saying, oh my gosh, you're really here. I can really talk to you. This is exciting, right? I don't do that anymore, which is good, because my new team probably thought that was a little odd that I was doing that. But you know how it is when you're working by yourself for a year and a half, you get excited when you see people. So it's definitely been a transition. So thank you for sharing your experience during the pandemic. I want to turn now and talk about what I had mentioned as part of the introduction, this new medical condition that recently has been designated as a disability by the EEOC and the CDC. It's called long COVID. And Jean, I thought perhaps we could turn to you and you could explain to us what is long COVID.
So I consult with the Centers for Disease Control and Prevention because I'm not a doctor, but people with long COVID apparently can have a large range of new or ongoing symptoms that can last weeks or months, or apparently now even years after they've recovered from their acute COVID infection. And apparently one of the factors that is associated with it is that those symptoms can worsen with physical or mental activity, which of course is involved with working. Some examples of common symptoms include tiredness or fatigue, difficulty thinking or concentrating, shortness of breath, difficulty breathing, headache, chest pain, cough, joint or muscle pain, depression or anxiety, fever, loss of taste or smell. And some people already have damage to multiple organs, including the heart, lungs, kidney, skin, and brain from their acute infection. And still others, if they've been hospitalized, will have long-lasting effects of, for example, being on a ventilator. So long COVID looks different probably in every person and can last an indeterminate length of time and be exacerbated by the act of going to work. So I think that kind of is in a nutshell.
Thank you. And would it be fair to say that there's so much more we don't know about long-term implications of long COVID?
I think that's absolutely true. I think we don't know what we don't know. It's still, evolving, and people are still trying to understand. I can say that initially, when the pandemic started, the U.S. Armed Forces were not accepting anyone who had ever had a COVID infection because they were scared that they didn't know what might happen later. They've changed that guidance now to anyone who is hospitalized for a COVID infection, but there's still the very real understanding that we don't know what the long-term implications may be.
Yes, thank you. And my understanding also is that children that have COVID also have the potential to develop symptoms of long COVID. Is my understanding of that right also, Jean?
That's my understanding as well.
Thank you.
Yes.
So Sonia and Jeannie, you both mentioned, it's part of your introductions, that you have experienced both COVID and long COVID symptoms that are continuing, it sounds like to me. So I'd like each of you to talk a little bit about the impact of long COVID on your ability to work and how it has kind of continued to impact your ability to work as this pandemic kind of shifts into a different type of pandemic than it was a year and a half ago. Jeannie, why don't we start with you this time?
Sure, thank you. For me, as I said, it's affected me just on an ability to kind of be the person that I was before I had long COVID. I would say before I had a lot of stamina that I just simply don't have anymore. I think part of it has just been the psychological toll of also having COVID. I know that like this past week I had some reactions to the booster I had, and just even that reaction, physically I had, the reaction to the vaccine, which was sort of minimal, but I also had some long COVID issues that I could feel, and sensations I felt that I hadn't felt in a really long time. And psychologically, where that takes me and puts me is like, oh no, is this happening again? I have to kind of, prepare myself. And I know that like last week when I was coming in to teach, I was overwhelmed. I didn't feel very well. And having to explain that yet again to coworkers and students, like if I sit, it's because I'm feeling dizzy or I'm worried about my heart rate again. I know concentration wise, it's impacted me. The brain fog issue, recalling information. At the same time, I've been working on research and a major research project through all of this. And I was revisiting a chapter that I had written and looked at it and saw all these typos and errors and things that I thought, oh, what was my mental state when I was writing this or working on this? And I recognized sort of like one that my brain has been able to function a little bit better since then, but it still is something that like I really have to sit and think differently than I did before because of just the way that my brain sometimes wants to function in entirety. Some of it has also just been, my job is very physically active. I'm standing a lot because the nature of the classes I teach, even this semester, it's a lot. I mean, I teach 2 acting classes back to back ostensibly, and I'm on my feet a lot. Last spring, I was working on a hybrid show. So some of the actors were only on Zoom and a couple were in person, where I was choreographing things. And I had my heart rate monitor on and, would be dancing and showing them steps and then be looking and be like, okay, I've got to sit. Because again, we're all masked and just the sort of weight of all that for me has been a lot. And it's a constant thing that I have an awareness for. So I would definitely say for myself, it's just, I have to be so keyed into my body and my health and my need for rest. My heart rate goes higher. My breathing's harder if I'm physically stressed, emotionally stressed, mentally stressed. So when those things happen too, I also have to take a step back. I was supposed to go to a conference at the end of this month that I kind of hoped at some point they would make hybrid or virtual. They're not. They're going full in person. And I thought to myself, okay, so like I can't go. I can't take that. I can't take that risk. I can't take that also just the stress of traveling across country to be in person for a couple days. And I'm just not who I was before in terms of being able to just be like, I'm good and I can go for this. And I'm not worried about like the realities of what this has done to me. It's something that, that I'm just constantly aware of every day.
And would it be fair for me to assume that before COVID and long COVID, these new issues that you're experiencing, and really sounds like you have to spend a lot of both mental and physical energy kind of proactively addressing, they just weren't part of your life
Not at
before.
all. Yeah, not at all. I mean, I went through, months of physical therapy in the spring just to build up stamina again, to be standing, to be doing things on my feet, to be carrying groceries in from my car, and just none of that was something I ever had to think about. I never had to worry about brain fog before. I never had to worry about being on my feet too long before. So yeah, it's changed my life entirely.
And do you feel, is this your new normal life experience?
Yes. Yeah. It's funny because people always ask, how are you feeling? And I say, I'm doing okay. And I have made some improvements, but there are also just aspects of my health that are I just kind of have grieved that like that might not ever be normal again. Like my breathing issues. It has never felt like when I take a breath like it did before I had COVID. And I've, gone through lots of tests and exams and everything else, but like I'm just sort of grieving with that. But there's a level of acceptance I have too. So that question of how are you feeling is always this weighted question of like, I tell them okay, or you say fine to be polite, but like there's still the reality of I'm dealing with this.
Thank you for sharing that. And Sonia, same question for you. What has your experience been like managing the symptoms of long COVID kind of at the start of the pandemic and now as we're entering into this new phase of the pandemic?
When I had COVID in July of last year, both of my children were home, so they helped take care of me. I went home with a nurse that would come and check me because my blood pressure, mine drops, and when it drops, I faint. And so I spent a lot of time just sitting or laying down when I was for about 2-3 months after I got out of the hospital. Then I started to feel better. In the beginning of this year, my symptoms just started to get worse and I started fainting again. And I have days like today that I feel okay. I'm never not dizzy, so I feel like I've always had a drink because I always feel dizzy, and it's really interesting when people ask me how are you feeling, and to make that choice. Okay, do they really care or do I want to say it? And sometimes I just say, oh, I'm doing great, because it gets old. And so I feel like also the toll that is having my mental health has been huge. I am taking depression medication. I was also diagnosed with ADHD, which now my psychiatrist told me that that it could have been also triggered by the long COVID issues. And the brain fog is just, I know that mentally there's things that I used to do. I used to be able to multitask and work on many different projects at the same time. I've had to stop some projects just because I just don't have the mental capacity to do it all, or to remember that I promised that I was going to do something. Even if I write it down, I forget where I wrote it down. So it's the mental fog is it's really hard to deal with. But on top of that, none of my friends, I don't have any family here, but so all of my friends are my family, and none of them have what I have. So when I talk about it, they look at me like, really, you're being dramatic sometimes, because it's so severe that I'm afraid to go places because I'm going to faint, but I have to because I live by myself. And also I am so tired of being at home. So for me, I come to the office sometimes just because I need that for my own mental health to be here. But I am dizzy all the time. I faint. I've had now about 13 days that I haven't fainted. So yay. But I always, I always feel dizzy, and like my brain is just not working. It works really, really slow.
And so Sonia, is this what you expect, excuse me, your new normal life and work experience to be going forward? Or do you feel that this might change?
I don't see it changing. I've had it now for so long that I don't know if I lost hope, but I've just had to make so many decisions and changes in my lifestyle to live like this. So I don't know. I don't see it changing anytime soon. Hopefully it will.
And you mentioned, Sonia, that you have children, you had children living with you at the start of the pandemic. And I'm just gathering from how you've described long COVID that there probably has been some change in your parenting and your support of your children. It's a little off the topic of work, but I think if you're comfortable sharing how that long COVID has impacted those relationships, that might be helpful for the conversation, so we have a fuller understanding of long COVID.
Yeah, definitely. My son goes to Iowa State in Ames. So before COVID, I was able to go and take him out to lunch, dinner, or brunch a couple of times a month, just to stay connected to him. And I'm not able to do that anymore. And if I make plans, I have to cancel. So, and with COVID also, he was struggling with his own academic and mental health. And at Iowa State, my daughter graduated from college this year, and she moved to DC. So we went, looked for housing, and that was really hard because I wasn't at my fullest. I still went, but I had to just sit so much and go so slow. And when I love public transportation in bigger cities, we had to Uber everywhere. So it was, I felt so, I'm just not at my full capacity. And I see the worry in my children, and I feel like that is even worse, to see how my health is affecting them. And so I've had to cancel, also on my friends, when we make plans, I cancel all the last minute because I don't feel well. And so that doesn't go over very well with me a lot of the time because I'm an extrovert. So I get energy from people. So to be at home has been really, really hard.
Thank you for sharing such personal information with us. I really relate to what you just said about gathering energy from people and how you really can't do that you kind of isolating at home because of you trying to manage long COVID. I too experienced that. I actually always thought up until COVID that I was an introvert. That's what all the psychological testing tells me. I don't think that's true because I had a really hard time transitioning from working with people and the energy that gave me to being by myself, sitting, working and doing, 15 Zoom meetings in a day. That I just really, really, really struggled to manage that. So for me, I'm happy to be back, partially at least, interacting with people. That helps my energy level. So I hope it's someday for you, Sonia, that can change, because having met you once, I agree you are very much an extroverted person. So let's hope that gets back to normal for you. Let's turn a little bit now and talk about working with long COVID, and each of you talk a little bit about kind of how you have managed these symptoms. You can include support that you received from friends or from colleagues. Anything you feel comfortable sharing would be great. And Sonia, let's start with you.
Thankfully, where I work full time, we have the Office of People with Disabilities and the CAPS program. So I got to hear from my coworkers about this being actually a thing, because none of my medical providers here knew what to do with me. At some point, my doctor said, I don't know what to tell you. And which made me feel like I was going insane, like I was losing my mind, that I was making things up. And so thankfully, in one of our staff meetings, they started talking about this, and that's how I learned that it was a disability, and that there's a post-COVID clinic here in the state of Iowa, and where I'm in treatment now. And so I just started missing work because we were expected to be back every day, and I just couldn't. And finally, I spoke to my supervisor and I told her what was going on, and they were very accommodating. I filled out all of the paperwork for to be able to work from home. So right now, the way things are is if I don't feel well, I'm able to work from home and stay at home. But I have in my work, they're very, very flexible with that. But it was, if I would have not been working here, I would have probably not known that it was a disability, that I had those accommodations. I know one of the things that it has affected a lot is, like I said, just the different projects. I just can't do as much as I'm used to doing, and so and that's really hard. But I do stay home when I have to. I love coming to the office now because I need to see people, but I stay home when I have to.
Thank you, Sonia. Jeannie, same question for you. How have you managed working with the symptoms of long COVID that you're experiencing?
Well, for me, again, a lot of it was, I'm very thankful to organizations and patients that have been advocating and uniting and sharing information, because like Sonia, I was standing in front of so many doctors who didn't think I had an issue or didn't know the correlation between that and having had COVID. So, the Body Politic, for example, has been an organization that I went to on an app, and started hearing information about, like, think about taking, putting on compression socks if it's, you're having this issue with your heart rate every time you stand, or think about, drinking lots of water with electrolytes, which I think, I mean, it's imperfect, right? But there was advice that was given, and a community there that was also rooted, I will say, in other chronically ill communities, that a lot of people in long COVID learned a lot from other groups, of disability and chronic illness, and we're saying, no, we know that experience of not being understood and heard by doctors, and like, here's what you need to be saying, or keep track of this, this, and this. And I'm very thankful that my workplace, that when I said I needed to be remote last fall, there was no shame about that they understood why I had to do it. There were accommodations made also in my teaching schedule. I would say this semester, being back full force and everything back, I'm still navigating how to explain this best, because I think everyone sort of had fatigue of what this pandemic means, and sort of having to raise my hand and be like, so that issue I have, I'm having it flare up right now, and I look okay, I look healthy, but inside I'm having, dizziness, or inside today, like, I'm having sensations that are hard for even doctors to understand. So I don't expect everyone I meet to understand that. And that even I myself don't understand entirely. So it's been a lot of, just kind of making it clear again and again about, like, this is a need that I have, or I can't do this, without also worrying. I mean, I do sometimes worry that because I'm non-tenured, like, there's all this conversation around my work all the time about, you need to be doing this, this, and this, and these are the things you need to worry about. And, there are times I just mentally have to kind of detach from that and think, if I get there and I'm in the good health to enjoy some of those milestones, great. But right now in this moment, I can't worry about, like, tenure, for example. And I also just have to say, I understand too, that a lot of people with long COVID haven't been able to work full time like I have. I know so many people with long COVID who've really not been able to get out of bed for months at a time. So I also try to address that with people, that this does not also, it's not what everyone looks like who's going through long COVID. Like, not everyone is able to then transition back full time into work. That's also not everyone's experience. And so that's just something I try to be mindful about when talking about it with other people, that I'm not the only person who's going through this. There's a lot of people in our communities that are, and it looks different for everyone.
Thank you, Jeannie. So I had mentioned briefly the Americans with Disabilities Act at the start of our conversation. I want to return to it just briefly, because I think it's important to understand that this is a federal law that protects individuals with disabilities from discrimination based on disability in employment and other aspects of life, but we'll limit our conversation today to employment. So a disability under the ADA is a person that has either a physical or mental impairment that substantially limits a major life activity. So physical impairments, I think most of us understand pretty readily what that means. But I do want to clarify, a mental impairment includes both cognitive impairments and also mental health diagnoses. So depression, bipolar disorder, anxiety, all of these are disabilities under the ADA. The ADA is a very broad protection, so it also includes things such as asthma, diabetes, heart conditions, right? Anything that could potentially impact a major life activity. So thinking, walking, eating, sleeping. There's also a category under the ADA that looks at, are you having a substantial impact on a cellular level? So if you have cancer, for example, that is also a disability under the ADA. If you have an impairment in your pancreas, that would also be considered a disability under the ADA. All of that is important to understand when it comes to what your rights are as a person with a disability under the ADA. It's a very strong, powerful protection against discrimination at work or other work-related benefits. It also offers protections in your ability to continue working by asking for a reasonable accommodation for the position that you have. Long COVID is also considered a disability now. And I think listening to both Jeannie and Sonia's conversations about the impact of long COVID, it's readily apparent that that would meet that definition, right? You have both physical and mental impairments that are impacting your ability to work, to live, to get out, interact with your friends and family. So when it comes to accommodations for long COVID or any other disability, some just basic important things to know that if you ask for an accommodation, let's say to telework, and you need accommodations to telework somewhere at home or wherever, your employer is obligated to interact with you on that request to see if that is something they can provide, whether it be a reasonable accommodation or not. So the fact that you're switching off-site to work doesn't change the obligation on the employer side to consider those requests for reasonable accommodation. So with that very brief ADA overview, I want to turn and talk about any accommodations that you might have asked for or considered asking for as you have been experiencing long COVID. And so Jeannie, let's start with you.
Yes, as I said before, I reached out to my direct supervisor, my department chair in the summer of 2020 about the fact that I did not think I was going to be of the health to be on my feet in front of students. And also just I'll be honest, the risk of getting COVID again, that terrified me. Not sure if my body could endure that again. And this was before any vaccinations too. So they were willing to meet that. They were willing, again, to allow that to happen. There was a lot of shifting that had to happen with my teaching schedule. Overall, the university has been very, I would say, very scientific about everything and understanding this. They have been willing to accommodate even students that were remote all last year. And in the spring, there was a big understanding still that we weren't, that we were still sort of cobbling things together, that hybrid needed to happen, that, some classes I shifted some classes only on Zoom and some classes only in person because the hybrid was also hard for everyone, including myself. To have brain fog and also juggle in-person students and a screen of students was a lot for me. I'll be honest though, in this fall, I'm debating about the fact of needing to pursue even more accommodations and being more clear about it, because I think just the fatigue of everything, people aren't quite understanding in the same way. And I know looking at my spring semester, it is a really overpacked, really stressful, lots of, just a different nature of the classes that I'm teaching that I'm now sitting here thinking like, yeah, I'm probably going to have to make this even clearer about accommodations I need met, just because of how I'm faring this semester. If this semester feels this rough, add more time to it. And I think next spring I'm gonna need more allowance, not less.
Thank you, Sonia. Anything you would like to add on accommodations and that process going through the COVID pandemic and experiencing long COVID?
For me here at work, it was actually my supervisor who gave me all the forms, and she said, you should ask for these. And so I took it to my doctor, and everything went very smoothly. Like I said, right now we have a 6-month plan where if I don't feel well, I stay home or I go home early. It seems like for me, as it gets later in the day, I start to feel worse. and sometimes early in the morning. So I have like 4 hours sometimes where I feel a little bit better, or I don't feel like I'm going to faint. But with work, I've been able to do everything from home. There's a lot of meetings that that I lead that I've chosen to not bring them back in person yet because I don't feel comfortable. Of course, I'm not able to make it, but and I don't want anyone else to be sick. Where I've had issues though with this is with school. I'm currently in school, and they've refused to provide me reasonable accommodations. So that has been the battle that I've been fighting. But at work, I've been able to continue to work, and they've been very accommodating.
Thank you, Sonia. And so I have experience in my job previous to joining DRI working with employees on the accommodations. And it was very frequent that prior to the pandemic that a request to work remotely was determined unreasonable. And so I think that this has been one of the very few good things that this pandemic has created, is that we now understand as a society, working remotely is not only possible, but has many positive benefits, both for people with disabilities and people without disabilities. There's a certain amount of flexibility when that is added when you can work remotely. But I do just want to remind our members here that joined us today, regardless of where you're working, the employer's obligation to provide accommodations does not change. So if you're working remotely and you need some assistive technology, or you need longer breaks, whatever the accommodation might be, your employer is required to enter into those conversations with you to decide if that is something that is reasonable for them to provide based on the job that you have. Let's turn and talk a little bit about the long-term implications of COVID on the disability community. And to lead us off, we're going to turn to Jean.
Hi, thank you, Catherine. So I'd say really there's too many impacts to talk about all of them, but as Catherine mentioned, the pandemic has generally had a disproportionately negative effect on Americans with disabilities, with a few exceptions. People with disabilities often have underlying health conditions that make them more susceptible both to getting an infection and having worse outcomes. The media have documented numerous instances where people with disabilities were outright denied treatment for a COVID infection, and some subsequently died. I think this is a huge disability rights issue. I think ableism has been on stark display during the pandemic, and it's something that we need to address for future emergency situations. People with disabilities often rely on people coming into their homes to provide assistance with activities of daily living, such as bathing, eating, and dressing. And in some instances, those workers didn't show up for fear of getting COVID or giving it to the people they were working for. So we've heard stories of people with disabilities lying in their own waste because there was no one there to help get them up. We've heard of falls, other just unfortunate events because the personal protective equipment wasn't available for people to feel safe providing those in-home services. So again, a failure in our system to provide the needed equipment that was needed for people with disabilities to live their lives the way they need to. In many places, paratransit services were discontinued or greatly limited, while other public transportation remained in force. So again, a problem with disability services. Services like grocery and pharmacy delivery are great if you can afford them and if you have the internet to be able to make the order. Many people with disabilities have neither. And many people with disabilities don't have good broadband access. So even doing things like going to the doctor, telehealth is difficult. But one of those silver linings is that for many people with disabilities who had transportation issues before the pandemic, if they do have the capacity to use telehealth, it's been a godsend for them. And it's kind of like employment, telework. I think that there's an understanding that telehealth needs to be made available to people with disabilities even post-pandemic because it can be very helpful to them. And as Catherine said, you know, people with disabilities have been asking for telework for decades and haven't been allowed to do that. And I think hopefully that will be one of the lasting positive changes to come out of the pandemic. And then Caitlin asked me to also talk about, will COVID disappear? Most experts think that COVID is here to stay. It will become endemic and stay around, but it will generally not be as widespread. And if more people get vaccinated or as more people have infections, the transmission will go down. But I think experts also agree that we're more likely to have more pandemics in the future with globalization and with urbanization. So the negative effects that we've seen from the pandemic among the disability community really need to be documented, really need to be spoken about, so that in future pandemics, or if COVID, becomes pandemic again in the future, we're better prepared to deal with it.
Thank you, Jean. So there are many different things that both employers and employees can do to mitigate risk of COVID in the workplace. Most of these are contained in the CDC guidance, and I'm not going to repeat all of the guidance because there's quite a bit of information on there. I would recommend that if you have concerns or questions, you check that website regularly. They update it as they learn more about COVID. But just generally, one thing that is important to know is that there are vaccines available. The CDC has indicated pretty consistently that that is the best way we can all protect not only ourselves, but the rest of everyone that we love. We now have boosters available. So some employers are making the decision to require vaccinations before they allow employees to come back into the office. That is permissible under the Americans with Disabilities Act, long as accommodations to that requirement are given. It's required both for disability, but also for religious exemptions for individuals that do not want to take the vaccine. It's important to educate yourself, and as an employer, it's important to provide education to your employees on vaccines, potential side effects, symptoms of COVID, and to proactively have in place a plan for how to support an employee that does contract COVID, so that you're supporting them, but also ensuring that that person does not spread that to the rest of your team. So some things you can do are offer flexible leave for an employee that wants to receive the vaccination or the booster. You can have a flexible leave for individuals that have come into contact with COVID and tested positive for COVID. Sometimes it's possible to work remotely while you're experiencing COVID, sometimes it's not. So just kind of thinking through all of those and making a plan so that you have that ahead of time instead of someone coming to you and not knowing as a company or as an agency how you're going to support that individual. So I see that we're getting low on time, and so I want to go back to the panel to add some kind of final thoughts and then turn over for some questions. So I think we've established here today that COVID is with us, right, for the foreseeable future. We've established it has changed the landscape of when, where, and how we work, and also how we ask for accommodations and what type of accommodations we all might need to work. So I want to give each of you a few minutes to give your best advice for going forward for employees to kind of mitigate risk, what you would want your employer now or in the future to do. And since some of you have talked about friends and family and kind of having this experience that people don't believe your symptoms and they don't understand, some advice on how they can better support you going forward. So let's start with Sonia.
I would say one of the things, if you see an employee that has always performed well and you see that things are not going as well as before, it might be that they have this and they don't know, because I know so many people have it and they have absolutely no idea that this is what it is. So I've seen people be getting fired or being on probation due to that. So I would say, question, maybe this is what it is. And if they, and just provide them the information for them to be able to ask for reasonable accommodations. It is so important. And just because, like Jeannie said, just because we look okay, we don't look sick, it doesn't mean that we don't feel like we're going to faint or that we are not dizzy, or that what you're saying is really not registered because we're still trying to remember what you said 2 seconds ago. So I would say give people the resources, the information, and when they tell you that they don't feel well, believe them, because it takes a lot to be vulnerable and say, this is what is happening to me, and not everyone feels comfortable saying that. And if you don't have to work from the office, let them work from home. That's what I would say.
Thank you, Sonia. Jean, let's turn to you next.
I guess I would say to employees to be your own best self-advocate, know what the law says, and don't be afraid to ask. And if you're an employer, I think probably you know by now that telework works, and that the job market is changing, and that people are demanding flexibility, whether that's moms with little kids or people who want to live in the country somewhere but still work in the big city. So if you're going to be flexible with your other employees, be flexible with your employees with disabilities and find ways to make the job work for them, because we all know it can work now. It's not debatable anymore.
Thank you, Jean. And Jeannie.
Well, I, of course, second what both Jean and Sonia said. And I would just say, for those people that have had long COVID, I've been very transparent about it, and I've made some social media posts, and it's been shocking how many people have reached out to me privately saying, so I think I am dealing with this, or how many friends and people that I knew that had COVID that then describe things like they still have loss of taste and smell, or they still have brain fog. And I'm like, so that means this is a prolonged illness. So I think some of it is just being more informed, both of people that have had COVID that might not realize that, yeah, as Sonia said, some of their performance issues might be related to long COVID, and they just haven't sort of recognized that. And I would also just tell employers, but really everyone, to be read up on long COVID, how many people it's impacted. I don't think we have the data conclusively of how many people around us are going through this or might still have this experience. And it's a lot of work to be somebody with long COVID, to have to always be the first person to have this conversation with somebody and explain to them what this is. Because at this point, it's been around now for over a year. And so I just say, try to learn something about it too.
Thank you, Jeannie. And so we have a question. The question is, as an employer, how could a reasonable accommodation be provided to someone to accommodate mistakes that are related to brain fog from long COVID? And so I thought maybe we're kind of short on time, but maybe a quick answer from each of your perspectives, and I'll try and answer it from my perspective as well. Jean, why don't we start with you?
Do you mean Jean or Jeannie? Because I don't really have.
Okay.
Okay.
We'll go with Jeannie then. Thank you.
Sure. One thing I would just say is that, having a conversation with this employee and talking about this and talking about, is there any sort of checks and balances system that they can have? If it's something you're expecting them to do a report, let's say, and then they immediately email it out. I know for myself, I've made more typos and mistakes than I normally ever did. And so it's a little bit about giving myself a little bit longer of a timeline for turnarounds for things, so that I can then, maybe if I'm mentally feeling a little bit better, a time of day might matter for when my brain fog is worse or not, but then I can come back to it at a better time.
Thank you. And Sonia?
I would say provide extra support. Maybe if something is due one day, have them turn it in a day before and have somebody else double check. My spelling is bad in English and Spanish anyways, but now it's even worse. So yeah, I would say just provide an extra support for them to not to double check their work, but just to make sure that they don't need extra help. They will tell you what will work for them.
Thank you. And so I think it's important to remember that the Americans with Disabilities Act grants employees with disabilities the right to ask for reasonable accommodations. It doesn't grant any power to the employer to say to the employee, hey, I see you making mistakes. I think you might need an accommodation, right? That's not permissible under the ADA. So this question really that's been raised is a good one, because if an employee comes to you and says, Mr. or Mrs. Employer, I have a disability, I'm having trouble with my cognitive abilities, I'm making mistakes, then the conversation turns to, well, how is that impacting their ability to do their job duties? And what potential accommodations could be put in place to mitigate those difficulties, right? And sometimes the person is able to say, well, if I just had a checklist, or if you could help me with a checklist or a reminder system, that might be helpful for one person. For another person, that might not be helpful at all. So it's really looking at the individual and how that person is experiencing long COVID as it's impacting their ability to work. And oftentimes, you need to pull in a medical expert to help understand what might be helpful for that person in the workplace. So all of the ideas that you mentioned are definitely great. And there's no one type of accommodation that's going to help someone who's experiencing long COVID with brain fog. There's probably an endless supply of potential accommodations that would help. So it is important to be looking at that in a broad way and really matching the need that that person is having with the job that they're doing. So I see that we are a little bit over time. I just want to thank again all of our panelists and the whole DRI team for their help in putting this event together. Please remember, this is the first ever DRI National Disability Employment Awareness Month celebration. We'll be doing another one of these in October. We also are planning regular scheduled events going forward. So we will be sharing information out with you as we plan those events, and we hope that everyone can join us. But thank you again for your presence today. Thank you to our amazing, amazing panelists. This has been both a very personal conversation, but I think very impactful. So I appreciate you sharing your experiences with us so that we all can learn from what you have been experiencing for the past year and a